Hello. We are all aware of snoring. Most of us have seen people snore or have heard people snore. And sometimes it can be so disturbing that it disturbs the sleep of everybody around. So, what really is snoring and where does the sound come from? It might come as a surprise to you that the sound of snoring does not come from the nose, but it comes from your throat. To know more about it, I'd like to tell you how exactly a snore takes place. When we sleep, there's a chance that our mandible in the lower jaw shifts back or drifts back, and also the tongue has a tendency to fall back into the throat. Now, what happens with that? When these two anatomical features, that is your lower jaw and your tongue, fall back into your throat, they give a pressure on the windpipe. Now, with the pressure on the windpipe, what happens is there's a constriction. It gets pressed. The lumen or the size of the windpipe reduces. And when air passes through a small aperture, you have a lot of vibration there, and that vibration produces the sound of snoring. Now, having said that, it's important for me to tell you as to the anatomical landmarks that are involved in this entire exercise. The palate, or as we say, the roof of the mouth, if you touch it and see for yourself, it's a hard structure. The tissues covering over it are firmly attached to the bone underlying it. But towards the end of the palate, the tissues are loose. And these loose tissues, which have the tendency to vibrate when air is forced through during breathing. Now, the body requires a certain amount of air which must go in, and that's decided by the vital capacity of our lungs. Our lungs have a vital capacity, that is, that much air goes inside our lung system. So when with air going in is reduced, then obviously a lot of things takes place. Now, there is a misconception about this whole thing. Whenever somebody is snoring and sleeping, it is generally conceived or understood that, oh, he is enjoying his sleep like anything. But the fact is that his body is crying out for help. Now, I am using he everywhere, it's just not. Now, mark it. The snoring is not confined to the male population only, it is even there present in the female population. And it will shock you to know that almost 50% of the population of a country is snoring in one form or the other. Why is snoring so important and why we should pay so much attention to it? Snoring is a precursor to a much, much more severe problem that is called obstructive sleep apnea. When a person sleeps and snores, the amount of air going into his system is reduced. And when the air going into the system is reduced, what is also reduced is the amount of oxygen going into the system. Oxygen, as we all understand, is paramount to our existence on this planet. If there was no oxygen, there would be no human life available, or for that matter, any animal life available. It's a very, very important constituent of the air around us, and any amount of air going in with less oxygen has very bad effects on the health of the individual. When the air is taken into the body system, it passes through the windpipes and into the lungs. And in the lungs, there are small alveoli wherein there's an exchange which takes place between the air which is going in and the air which is brought by the blood into that area. Oxygen is taken in and carbon dioxide is given out, and the things keeps moving for you. Even when we sleep, most of our body systems are functioning. And one of the biggest systems which is functioning is our brain. And when a depletion of oxygen takes place, so far as the brain is concerned, the brain is not allowed to have the relaxation that it would otherwise have had if it was provided with sufficient amount of oxygen reaching it. The result is the person who is snoring and sleeping, not getting enough oxygen into the system, and the brain is affected by a poor supply of oxygen. He has a tendency to be not so alert during the daytime. You will find people who just doze off on their seats. They're talking to you and they just doze off. It's because they have not had enough sleep or enough good quality of sleep. When I talk about good quality of sleep, there is two issues involved here. One is the quantity of sleep and the other is the quality of sleep. All of us are quite aware that quantity doesn't really matter. What really matters is the quality. Similarly, when we talk about sleep, it's not the quantity of sleep that a person is enjoying, it's the quality of sleep that the person is enjoying. Now, having said that, I'd like to tell you that a human being can exist without food for maybe 2 weeks. Okay? But if a person is not allowed to sleep for 10 days, death is very certain. So what does really sleep do to you? When human beings sleep, there is a relaxation in the body system, the whole body relaxes, and the body rejuvenates, it gets recharged. That's why when you get up fresh, you say, oh, I'm fresh, I can do anything in life now. I mean, I'm fit to do my chores, I'm fit to do something new. But if your body has not relaxed with a good quantity of sleep, obviously your performance during the day is not going to be up to the mark. Sleep medicine is a very specialized subject now in medical sciences, and a lot of attention is being paid to the quality of sleep that human beings enjoy. And one of the factors which doesn't allow you to sleep well and affects the quality of your sleep is snoring. Having said that, now you probably want to know, what should one do with it? Now, I don't want to talk in terms of obstructive sleep apnea because everybody knows about obstructive sleep apnea. I'm here to tell you is that all major problems in life or all health problems with us start small, and when left unattended, they blow up and become rather major, and that's the time we are suddenly aware of them. Similarly, snoring is a small issue which when it starts with just a little habitual snoring, and we tend to ignore it. But when you allow it to grow further and further and further, and when it goes unchecked, it becomes into a very major medical condition called obstructive sleep apnea. A lot of MNCs in our country give advertisements for people trying to bring their attention to snoring. Okay, so snoring is extremely dangerous and an oft neglected subject. So what is the treatment available to us? Depending upon the stages of snoring, which stage of snoring you are in, the medical profession gives you a solution for it. And mind you, when I say the medical profession, I'm a dentist, right? I'm not going to be encroaching on the area which is not mine. I'm not trained to talk about it. However, I would definitely like to speak on one of the treatments which is available, that is the oral appliances. So coming back to what are the treatments available, one is called the CPAP, or there's a machine which is kept by the bedside. There's a mask a patient wears, and regular continuous pressurized air is passed into the body system to make up for the loss of air which is going into your body system. That is what they're trying to make up, is the deficiency of oxygen which is reaching the body system. That is one. The other is to get over snoring and to give you a clear passageway. The ENT surgeons give you a surgery on the soft tissues of your throat, and that is conducted at the upper end, wherein the soft tissues is cut off, and it may regenerate again. That's a different issue, but it helps you to overcome the sound of snoring. The third is where the dentists are involved, and that is called the oral appliances. Oral appliances are appliances which are fitted into the mouth, and what they really do is give you a mandibular repositioning. Now, if right in the beginning of this presentation, I said that the snoring is caused by the posterior or the falling backwards of the mandible and the tongue into the throat, giving pressure onto the windpipe. So what these appliances really do is reposition the mandible during sleep into a position which doesn't allow it to fall back into your throat, thus saving you from snoring. Now, how both the other systems, that is the pressurized air and the surgery which is conducted, do not address the basic cause of snoring which takes place in your mouth. Now, how dangerous is snoring? When the windpipe is constricted, then there are chances, as it progresses further, there are chances that actual flow of air stops for a few seconds into the body system. And that is when a trigger is set off and the person wakes up in an alarm, clears his throat, and again goes back to sleep. So this real start with a jerk, as I would say, can put a lot of pressure on the heart and can lead to a situation wherein a person can lose his life. You got a congestive heart failure. Suddenly you got this thing, sort of a jerk onto your system, and the patient may not be able to recover from this. We have seen instances where a person is found dead in his bedroom, and everybody just says, oh, he was sleeping very beautifully, he was snoring and sleeping very well at night, and when we found him in the morning, he had passed away. Chances are that they do not have any medical history or recorded medical history of a person having been a snoring addict or addiction to snoring. He may have had a seizure at night due to the reduced air that is going into the body system and reaching a situation where it's called apnea. Apnea is where no air goes into your lungs, and that is obviously when air is stopped to your body system, death occurs. Now, the purpose of this presentation is that the snoring is a very important issue. If you will notice that there is a website which is being shown to you here, where you can go and collect more information on this. And the good part is that if you are snoring and if your family complains that you're snoring, it's time to seek help. And in the initial stages, the best person to help you is your dentist. So with that few words, I'll take leave, and I do hope that you will look into this matter and give it the importance that it deserves. It's a very major health issue, and one must address it as soon as you can. I would request that should you have any queries to this effect, please put them in the comment section. And if you like this video, kindly share with your friends, because a lot of people need this kind of advice. And also subscribe to this channel so that we will keep you informed of other issues wherein dentists play a very major role in general health care. Thank you very much for your time. Goodbye.